It was really hard. It was like, she'd call me, what do? Do we up the indomethacin? My weight's at a kilo over, my weight's come down, do we half it? How long do we take it? It was like, we're medical students, like, let the doctors figure it out, but no one knew. Like, no one knew.
There has been 43 cases worldwide reported on this condition.
The entire pregnancy, I was as anxious as Bridget and Jouni.
When I actually delivered Connell, to be honest, it was terrifying. I was scared.
If something needs to get done, it's the right place to be.
It's a brand new day. The sun is shining. It's a brand new day. For the first time in such a long, long time, I know I'll be okay.
We have 4 children living here with us, and we had a daughter last year who passed away, so we've had 5 kids. Connell is the youngest. We have 2 girls who are 10, twins, and a 7-year-old boy, and Connell, new on the scene, 5 months old.
So the first time I met Bridget and Jouni was in the fetal diagnostic service, but it was with the pregnancy with their affected baby Cerys. She was referred because of the ultrasound finding of short bones and having lots of fluid around the baby. And what I remember from that visit is how much they were seeking information and answers, and how they wanted the very best for this baby, and how perplexed we were at arriving at a diagnosis. It was a very difficult case.
The pregnancy we thought was going fine, and at about, I think it was about 26 weeks, I started to get huge. And so my physician at the time sent me down to Women's Hospital for ultrasounds.
The outcome of this pregnancy was, of course, very sad. She ended up having preterm delivery and laboring at 28 weeks, and her little girl passed away a few minutes after birth.
Having walked with her through that year and through her experiences is what really cemented our relationship. She allowed me to meet her daughter at the hospital and bear witness to her short life. And I am so grateful to her for that.
What was an extremely sad and horrible moment for this parents led to also more information about what happened to this baby. Unfortunately, there's a genetic aspect to this condition.
So Caffey disease is a rare condition. We recognize it because of the changes in the bones on x-rays. And so instead of having a thin bone, there's all this reaction and lots of bone formation all along the long bones. And it's very characteristic. So radiologists will look at the bones and will be able to describe it and make the diagnosis of Caffey disease.
There has been a few cases of a situation like this happening twice in the same family. So we had the notion that this could happen again as well. This couple was devastated to hear the possibility of another tragedy in their life. As a mother, I related to them so much in terms of you could only imagine what losing one of your child could be, and they had just gone through this.
When we conceived Connell, we hoped for the best outcome. We were told it was probably about a 1 in 4 chance of it recurring. And then when we found out at about 24 weeks that he had the same disease, we learned from Cerys. She taught us a lot.
Connell had Cerys as his little guardian angel. That's what we like to say. So I think that was she was looking after her little brother.
It became apparent that pregnancies affected with Caffey disease early, so like what we were seeing in Bridget and Jouni, had a risk of prematurity, of delivering early. And it was really delivering early that probably was the greatest factor in leading to the death of those children. And that if we actually were able to keep her pregnant as long as possible, that this condition, which is still quite mysterious to us, would likely resolve with time. And so it was a question of reviewing the literature, trying to see how could we sort of prevent a premature delivery. And so it was really the work of Dr. DeLille in reviewing, okay, how could we tackle this accumulation of fluid? What could we give to Bridget that might change that course of the illness and lead her to be pregnant as long as possible?
The goal was for me to have Connell in Vancouver, where he could have the best care possible with the excellent nursery down there.
What is special about Bridget is the fact that she's first an experienced mom, had had pregnancies before, but during her pregnancy was going to the final step of her medical training.
Bridget kept in touch every time we got one more week and one more week and one more week. I was becoming more and more positive that this time they would have a healthy baby to take home. And I remember, which turned out to be just a few days before she ended up delivering, she came by my office and I recognized that, wow, like we've made it far this time. Like I think this is going to be a healthy baby. And I said that to her and she said, I don't know, I'll believe it when I have this baby.
Actually, it was the weekend before I went into labor. We'd said to each other, we talked about it and said, this is the week you're not coming back. I think I was at the end of my 32 weeks or something. And even the weekend before, Dr. DeLille had seen that I was going home and she shook her finger at me and said no.
And it was a pretty magical moment because it felt like a moment, like a triumphant moment of, you know, it was all worth it.
Intellectually, I know that I guess the level of courage or strength that Bridget has is quite high. And again, for me it was tough, but much more difficult for her. So in the end, everything worked out very well.
It was so much better to have them home and everyone back where they finally belonged. I'd been away for so long, for months and months, and it was just so great to be home.
We are doing research on Caffey disease. We're trying to collect families from across the world because perhaps with a greater collection of families we will find the gene responsible for this condition. Maybe we could even treat the pregnancy in a more effective way if we knew what causes it and how we can treat it. So it's exciting to be in genetics right now. There's lots of research going on and we're finding new things, and hopefully we will improve the care of families in BC.
The joy of seeing little Connell or other babies like this that are such important in our life gives us pleasure and a smile for weeks and weeks and months.
As a one-liner or a cliche, that at the end of the day, that's a big part of BC Women's is every child is a blessing.
It's a brand new day. It's a brand new day. For the first time